this virtual style and still let you know about all of the resources and opportunities for you and your families as you're expecting babies. I'm Professor Libby Rosen. I teach at Baker School of Nursing, but I've worked at Stormont since 1983, helping people have babies and working in the breastfeeding clinic and teaching lots of classes. And we really want you to know about that. We're going to introduce each other so you know who all will be presenting to you tonight. So Ashley, would you like to go next?
Yes, my name is Ashley Seematter, and I'm a registered nurse that works on the birthplace, and I'm also an instructor for Baker School of Nursing. Rachel, do you want to introduce yourself?
Hi, my name is Rachel Alt. I'm the nurse manager for the pediatrics, pediatric intensive care, and child life departments here at Stormont Vail. And I also co-coordinate Safe Kids Shawnee County.
Oh, and I'm Dr. Gilpatrick. I'm one of the pediatricians over at the Con O'Neill Pediatric Clinic.
My name's Laura Odom. I'm a registered nurse and lactation consultant in the breastfeeding clinic at Stormont Vail and teach the childbirth education classes.
I'm Allison Wilson. I am the administrative director of nursing here for the maternal and child service lines. So I get to work with all of these wonderful colleagues, NICU, pediatrics, birthplace, breastfeeding clinic, and maternal fetal medicine.
I'm Melinda Tice. I'm the nurse manager of Birthplace and the Breastfeeding Center. Welcome to our first virtual Baby Jubilee.
Well, all of these wonderful people are going to be able to give you a tremendous amount of information, and we're also going to be putting things on the comment section, and so you can learn as much as possible about all the resources available. Laura's going to start out and talk to us more about information for support and education.
Thanks, Libby. So we currently are offering our classes virtually. We have once a month the option to sign up for a childbirth education class, and that's going to be held by either Zoom or Skype, depending on the instructor, and they will send out a link to those people who have signed up. You can sign up on the Stormont Vail website, and there are different dates. There's one coming up in February, and then we have March and April, and we'll add more if we're not able to have our in-person classes at that time yet. On our website, you'll also find information and presentations that have been pre-recorded for our Welcome Baby and our Breastfeeding Basics classes. The childbirth education class is going to cover the labor and delivery aspect of things. So we're going to talk about how to prepare for your delivery and how you can find different coping mechanisms for labor, whether that be pain management with epidurals or Stadol, or if you're using breathing and relaxation techniques in addition to those things, or in place of. We can talk about visualization, imagery, massage techniques that your support person can learn and help you with, and how they can be an active part of your experience as well. So the childbirth class will cover a lot of that information, and then the Welcome Baby class talks more about prepping for your baby. So what to expect with a newborn, and you know, kind of what they look like right after birth. They don't all look just like the babies that you picture. So they have, you know, umbilical cord stumps and sometimes dry skin and just different things that you may not expect. So that class will do a great job of kind of preparing you for what your newborn will be like and what you can do to care for them. And Breastfeeding Basics talks a lot about how you can be prepared for breastfeeding your newborn. That's, you know, we always say it's natural, but it's not knowledge you're born with. So coming to the virtual Breastfeeding Basics class will be a really great way to get you kind of just some basic information on what to expect with your newborn and how you can be prepared. Talking about, you know, we can answer questions about how to get your breast pump and when do you need that? When should you start pumping? How do you know your baby's latched well? And other maybe common or uncommon things that you might encounter. So the breastfeeding basics and the welcome baby class are up on the website where you can watch that. And then actually starting this Sunday on the 31st and once a month from then on, Libby and Ashley are going to have what's called a Ask the Expert. So it'll be a question and answer. After you've already viewed those classes, you can join by Zoom, I think Zoom or Skype. They'll send you a link. If you're interested, you can email Libby and they'll just answer specific questions that you have. Or if you just want to join and hear what other people are asking, maybe you don't know exactly what you want to ask them, but somebody else might have a question that would benefit you too. So those are some options for our virtual classes. You can sign up on our website. If you are interested in any of the classes, but you can't access something or you can't, the date that we have for the childbirth class isn't going to work before your due date, then please send me an email or call me in the breastfeeding center at Stormont, and we will work something out so that you get that information. So we really want you to be prepared and to feel less anxious and more confident about what is coming for you. I also want to mention that on the website, we have a virtual tour, and that does a really great job of kind of showing our services for the birthplace and the breastfeeding center. In the breastfeeding clinic, it's a very unique place. We are kind of one of a kind. We're staffed every day of the year, even on holidays and weekends. And we're there to help you. So we currently are not able to do just a walk-in clinic like we normally do, but we're still there every day and just to schedule appointments ahead of time. So if you have questions after you've gone home, and typically they'll have you come back at least once to see us after you go home, make sure things are going well. But we see people often for as long as you want to come in and get weight checks and make sure things are going well. We also, if you view the virtual tour and feel like you need more information about that or would like to see about setting up an in-person tour, we can do that if needed, but hopefully you'll get lots of information from what we have on our website already. So again, if you have any questions about any of the classes we offer or how to get more information about any of that, just contact me at my email, which should be posted in the chat. And you can call me in the breastfeeding center if you need to.
Thank you so much, Laura. We have lots of great education, and Laura gave you lots of ways to get access to that. I do want to let you guys know that we're going to be doing a giveaway like we would if we were in person. We've got a couple, actually, I think we have 10 books. The Nobody Told Me About That, the first 6 weeks. It looks kind of like this. And then we also have a sleep sack with some baby booties that Melinda has there. And then we will also have a feeding pillow to give away. So we really want you guys to interact with us and ask us questions. So those first 10 or 15 people that post questions, we would love to give you some goodies. I would like to pose a question to Rachel. Rachel, can you tell us what is the best way to make sure that we have a safe car seat for our new babies?
So there are a lot of resources out there online. I would say that it is not something that is super intuitive for parents. A lot of people expect installing a car seat to be simple, but it actually can be kind of complicated. So we recommend having your seat checked by a certified child passenger safety technician, if at all possible. So as I said, I help co-coordinate Safe Kids Shawnee County. So part of my role is ensuring that babies and children in our community just have all of the critical safety needs that they might require, and helping families be able to access those if they can't. We are super lucky here because Stormont Vail is our lead agency for Safe Kids Shawnee County. So we are able to provide a lot of those services that we provide to all members of our community, but just a little bit easier sometimes here. Child passenger safety. So if you are aware, we used to do monthly check lanes out in the community. You would see us at Dillon's or the fire department, anywhere like that. We used to do those on the second Saturday of the month. And of course, with COVID, that has been a challenge this year. So we have transitioned to doing virtual car seat checks. So we can do those via Zoom, Facebook, Messenger, video, Zoom, Skype, whatever platform you prefer, we can pretty much work with. And we have several, I think around 20 child passenger safety technicians on staff here at Stormont Vail now. And so to connect with one of us, you can email carseat@stormontvale.org. And we'll set up an appointment. We can do a virtual appointment with you, or if that is not going to work with you, or if we do the virtual and we're still having problems, we'll go ahead and schedule you for a one-on-one appointment with one of us here at the hospital. I believe there will be some links available in the comments for you all, because like I said, there are a lot of online resources for that. A lot of times I get the question about, if I don't have a car seat, how can I get one of those? So we do have, we're lucky, the Stormont Vail Foundation and some of our community partners, we do have some seats available for families who are unable to afford a car seat, or our partners at the Kansas Traffic Safety Resource Office can also help families out, and they're right here in Topeka and super accessible as well. So.
Excellent. That's important information, and we're putting those links up. Plus there'll be some from partners that would have typically been with us at a Jubilee. They'll be letting you know how to contact them to find out about more resources in the community. But we have some kind of exciting news of some changes that have recently taken place at the birthplace. Melinda, would you and Allison, maybe you can start, Melinda, talk a little bit about how Stormont Vail assures a safe delivery of mom and baby, and all about our services.
Yeah, thank you. So even though Stormont's commitment to having a safe and healthy delivery remains the same, we have the same commitment to that. Obviously in this pandemic, things do look different. And so I'll just cover some of the common questions that we get if you're going to deliver your baby here. The first one is visitors. And so that's the exciting news is we've had previously just had one designated visitor that we would allow really for your safety and our safety, reducing the amount of people that come in and out. But over time, we've had patients that need a little extra support. Specifically, they've asked for doulas, their mom, whatever the case may be. We have decided to allow 2 designated visitors now, so we can support you bringing your spouse or your sister along with your doula to make sure that you have that support that you need. So that's super exciting. We also offer coach trays. So if you have your coach person here, it reduces the back and forth in and out of them leaving. So we offer food for them. The other main question is about masks. Do I have to wear a mask the whole time? Do I have to deliver in a mask? And, we ask that patients and their support person do keep on a mask as much as possible when staff are in the room. What I can say is that staff will always be in the appropriate PPE and will be in our stuff to protect you. However, we want it to make it as family friendly as possible and support you in what your birth plan is. So that brings me to just the in and outs of the delivery portion. And delivering here, everyone has their own idea of what birth is to them and what their plan is. And no matter what that is, we really will support that. And you'll have all of those tools at your fingertips. If you are scheduled for a C-section or scheduled for an induction, we'll call you a few days prior. We will make sure everything's kind of planned out and set up and you have as much information as possible before you come in. We do encourage you to get COVID tested before you come in. We screen everyone, however. If you want a low-tech, low-intervention birth, we can support that. We have hydrotherapy tubs, we have balls, we have lots of resources, and our staff are super qualified in many ways to help support you in your whatever your plan is. If you happen to have COVID or have to experience that, we're really prepared. We offer the same large birthing suite. We encourage all the same things we would if you were COVID negative. skin to skin, feeding your baby, rooming in, your support person being present, and keeping mom and baby together as best as we can for everyone's safety. If you had a premature delivery or something unexpected happened, that's the beauty of being here, is we have all those resources at our fingertips to make sure and ensure that safe delivery for you and your baby. Allison can speak to you a little more on the NICU and their side of things.
Sure. And I'm going to address, I think there's at least one question real quick. We'll get it at the same time. I see a question on here about if patients are needing to register their support people or do anything ahead of time. So with that, just what I want to say, I guess, is that when we call to schedule you, when our birthplace registration makes that telephone call, they can get that information from you right then. So nothing that you would have to specifically call yourself. We want you to focus on you at home, but when we're making that appointment for you, we'll ask for that. And if not, we can take care of that as soon as you arrive. Obviously, many times you aren't going to come in on your scheduled time. You'll be in well before that. So wanted to address that piece of it. For the NICU, Melinda's right. We want to make sure that we're prepared for every type of delivery and any possibility of extra attention that your baby may need. So here at Stormont, we do have our level 3 NICU. It has 27 private rooms. So it's a really wonderful resource for families that require NICU care after delivery, that you're all still here in the same hospital. You have access to your baby 24/7 here in the same hospital, just within the same walls. So, we have really just a wonderful space and a multidisciplinary team that work together. We support visitation regardless of illness. So we want this to be your experience. We want this to be a family experience. The birth of a baby is an amazing thing. So if there is COVID added into the equation, we'll support that as well. Not only do we have in-person opportunities for visitation, we also have virtual visitation. So one thing that some people sometimes ask is about the age limit for visitation. And I will say that we do have an age limit for visitation. This was not COVID specific. So this was much more, we've had this for several years with cold and flu season. And we restrict down just a little bit with all of the viruses in the community, just in the winter months. We restrict down, which is why we really encourage, and we've gotten to be very, very good at virtual visitation. So we're able to support skin to skin inside the NICU, no different than we can in our labor suites up on the birthplace. If dad wants to hold baby and mom is there and the siblings at home and wants to read a book, it can still be considered family time. We have great ways to do those things as well. So thanks.
That's wonderful. And Melinda, could you address one of the questions that came through was, will support people be allowed to come and go, or will they be required to stay at the hospital once they get there?
Yeah, absolutely. They can come and go. They're not locked in or anything like that, but we do just educate the families that reducing the back and forth is best practice. So if they need to leave, or sometimes we have a common situation is because they have other children at home, dad wants to leave and stay with them, or mom sometimes wants that too, then that does happen. They go home and feed the kids, put the kids to bed, and then come back and stay the night. So yeah, they're not locked in.
Okay, and Laura, a question came through about if you've gone through childbirth before and you just want to have a refresher, can you still attend the classes?
Absolutely. I would strongly encourage you to do it because you never know what options have changed since the last time that you had a baby. And I think it's just nice to kind of remind yourself some things that we may intentionally or unintentionally forget after we've had a baby. So there may be some other things that you didn't know before that can be helpful for you. So you do not have to be a first-time parent to join our classes. We want anybody and everybody to join in and be prepared.
Perfect, thank you. I got one more question. I think Melinda, you can answer this, and then I want to ask a question of Dr. Gilpatrick. Question is there any pre-registration paperwork that can be filled out ahead of time prior to going to the hospital?
Yes, of course. We have pre-registration. It's all on the website, or you can call the birthplace directly, and we have registration staff 24/7 that can help get you pre-registered.
Thank you. So Dr. Gilpatrick, once baby arrives, families might have lots of questions. How maybe could they get in contact with a pediatrician for their baby once delivered? And go ahead and unmute yourself.
So yeah, congratulations to the new parents once the baby arrives. Having a newborn is very exciting. Lots of new things happening every day, but also lots of questions, lots of challenges as well. So make sure you have a good support system. Reach out to your family members and friends, and of course your friendly pediatrician. When you are ready to schedule a newborn visit with your pediatrician, which we typically see newborns within the first 5 to 7 days, after delivery, you can tell your hospital staff who you would like to follow with, and they can help arrange that appointment. Or you can also call our clinic, and we can help arrange that as well. At Con O'Neill Pediatrics, we have 2 great locations here in town. And at both locations, we have providers who are taking new patients. So make sure you call us. There should be a phone number on the comment, so give us a call.
Thank you. Rachel, could you clarify again for us where they can get their car seat checked at?
Sure. So there are actually several places you can go in Topeka. The Kansas Highway Patrol does some car seat inspections. You're going to have to probably check with them on how they would like you to arrive and maybe not just show up. Mission Township Fire Department does have a child passenger safety technician on staff as well. The Kansas Traffic Safety Resource Office, they're 29th and Wanamaker-ish. They're an option. And then, like I said, through Stormont Vail, we have virtual appointments, or we can do one-on-one that we would do right here at the hospital. You would just need to email us and set up that appointment to get that done.
Okay, and I know sometimes new parents want to know, what do I have to bring with me to the hospital when I come? And typically the diapers are going to be provided for you. And trust me, you're going to want to invest in diapers. I wish many years ago I would have bought stock in Pampers, because babies go through about 12 a day for sure. And you can bring with you a special outfit that you want the baby to wear, or anything that you want for when they get their picture taken. And the photographer is back taking pictures of newborns again, and that's exciting for us. But is there anything else about a newborn, Dr. Gilpatrick, that might surprise parents? Maybe talk about the umbilical cord or the way they breathe as a newborn.
I'm sorry, the way they
babies, you know, do that kind of irregular breathing that can kind of scare parents. They kind of go, you know, they make little funny sounds and noises.
Absolutely, you're right. Newborns can do strange things to us sometimes, but to them, they're very normal. So they can have different pattern of breathing that is normal to them and nothing to be worried about, and usually will get better with time. You parents may notice that the umbilical cord gets dry and gets almost detached. And this also is very normal as well. And it usually takes about a week or two before that umbilical cord falls off. And you don't really need to do anything extra to the umbilical cord except keeping it clean and dry, and that usually is all you need.
Okay, Laura, maybe you could address what opportunities does the support person have during labor and at the delivery, like cutting the cord and what that's like.
Absolutely. So certainly cutting the cord is something that they can do, and that is a very special moment for them. My husband insists that the baby's belly buttons are perfect because of his cut, which is silly, but it's something that he enjoyed being part of and remembers forever. As far as labor goes, during our childbirth classes, I know Daniela is the other instructor. She and I both like to focus on things that your support person can do to help you cope with your labor pains. So we can help them learn how to time your labor contractions, when they should maybe call the provider and let them know that you're feeling like you should head into the hospital, and kind of be that person communicating with them. They can practice different massage techniques. I strongly encourage support people to practice the breathing techniques with you, because if they practice with you, then it's easier for them to actually remind you or help you with those during labor. And I think your support person reads you better than anyone else. So if they are watching you go through these labor pains, and the nurse has suggested a certain technique that might be helpful, but your support person can read that maybe that's not something you are enjoying anymore. Maybe it worked a little bit ago, but you seem to be showing some signs that that's not really working anymore. They can suggest something new, like, would you like me to rub your feet? Would you like to get up out of bed? Would you like me to massage your back or put some pressure on your lower back? And so our goal in class is to not only educate you about the process that's happening with your body and what's physically going to happen, but how you can both be prepared to manage that. And I always say, have as many tools in your toolbox as possible, so that you actually can pull from different things. Maybe it all sounds good at the beginning, but might not feel as good as it sounds. So we want you to have lots of options, and we're going to help them to feel more confident about that as well.
Great, thank you. Dr. Gilpatrick, I think there's another great question for you. Somebody would like to know about circumcision at the hospital.
So I'm not exactly sure who will be performing the circumcision at the hospital, just because I'm not involved in that process.
I can help you with that.
Okay.
Yeah. So I'll start. How about that, Dr. Gilpatrick, and you tag on. How's that? Okay. So here at the hospital, once your baby is delivered, we have pediatric hospitalists that are in-house that help take care of any baby that's born here. And so those physicians that we have, it's a wonderful group of pediatricians. They are here or on call 24/7. And they will be the ones that will actually be able to help make sure that if you have wishes for a circumcision, we can get that done prior to discharge. Now, some people during this time frame, or for one reason or another, may choose not to get the circumcision done just a couple days after birth, and we can always make an appointment, and we can do that after the fact. We'd work with your pediatrician that you see on an outpatient basis and get that scheduled. So no problem. Our nursery team or our pediatric team, either one of those great groups of nurses are there to support the pediatric hospitalists as they're caring for your baby. That's a good question.
And there are different ways to do the circumcision. One way that I have seen is the one that has a plastic ring still attached to the penis. So that plastic ring will be attached until about a week or so after the circumcision. So that would be something that we can talk about and take care of when you guys come to the newborn appointment.
We actually have 3 different types of circumcisions that we offer here. And if you are well versed in what you actually have a wish, like she said, if you want to have a Plastibell or something like that, you can request that. And most times within a day or two, we have several physicians here that we can do our very best to accommodate that. Great question. There's also a question on here. I think I'm going to address it right now, if that's okay.
Yeah.
It looks like Danielle maybe asked, any advice or your thoughts on pregnant women getting the COVID-19 vaccine? Well, that is the hot question of the day, isn't it?
I agree. I agree. So we have limited data right now on the safety of the COVID vaccine on people who are pregnant or breastfeeding. That being said, most experts believe that this vaccine should not cause any problems in those particular group. So at the moment, these vaccines, we have limited amount of these vaccine anyway. So these vaccines are recommended for those who are at high risk or increased risk of getting severe illness if they do get the COVID virus. So if you are breastfeeding or if you are pregnant and you fall within this increased risk or high risk group, I strongly recommend that you think about getting the vaccine. And then if you have any questions or specific questions or concern, make sure you talk to your primary care physician or your OB or of course, your pediatrician as well.
Great job.
And any other questions coming in? Can we, if anybody else has things they want to discuss with us, we are here to answer your questions. Does anyone else on the panel want to give any last hurrah of great informations?
Rachel, do you want to tell us a little bit about Safe Sleep and baby?
Yeah, I would love to. So in addition to focusing on child passenger safety, another large area that I work with is safe sleep. So for all infants less than 1 year of age, but especially those newborn babies, we are going to make sure that we're modeling the appropriate behaviors here in the hospital, and then we'll teach you while you're here about the proper nuances on safe sleep. So the basics of that really are the ABCs of safe sleep is what we call, which means we want baby to be alone. And by alone, I don't mean just leave them alone, but in their crib with no blankets or stuffed animals or anything like that. We want to place baby on their back every time we put them to sleep. And then we want them to be in the crib or at least in a separate sleeping arrangement, whether that be a bassinet or a portable crib. We do also have sleep sacks like the one that Melinda showed earlier. So I believe all deliveries get those upon discharge now, but we have plenty of them for use here in the hospital, whether that be in the NICU, on the birthplace, or even on pediatrics, so that we can model that appropriate behavior for you. And then we also screen all of our moms on admission. You'll be asked about if you have a safe sleep location at home for your baby. And if you don't, we have some resources to be able to get you a portable crib, which is essentially a pack and play, so that you can take your baby home and have a safe place for them to sleep if you're not able to access that. So our social workers do a great job helping with that. We're very blessed to have this foundation help us with those funds. And then we also participate in a local group called Healthy Babies, which is through Heartland Healthy Neighborhoods. We assist with 2 times a year, we do community baby showers. And what that is just an educational event where expecting parents can come and receive education. They also get a lot of information on community resources similar to Baby Jubilee, but it's a little bit more heavily focused on safe sleep education, breastfeeding education, and smoking cessation. And so we assist with those twice a year. And because all of those things, we are really proud that we are a certified safe sleep hospital at the gold level, which is the highest level. So all of our efforts all around safe sleep, we're really proud to have that certification.
And when we talk about sleep, sometimes new parents have some stresses, and one of those can be related to sleep. That's what I did my doctorate on. But there can be other stresses, particularly at a time like now with COVID. So Allison, would you like to share some information?
Sure. Yeah, Rachel had triggered my memory too. So I've just wanted to talk about the emotional stress, not just of having a baby, but also, you know, where we are right now in the midst of a pandemic. So it is, you know, unprecedented and uncharted of how do you have a baby? What are you thinking about for their future during the COVID pandemic? So I just think it's always wonderful to point out we have a great multidisciplinary team on every department here. Our social workers that work here, they are not a social work team that would just become reactive and come to you when you need help, but they're part of our day-to-day business. They talk with our families. And we together as a group actually help make sure that you have a successful plan taking your baby home. One of the wonderful programs that we also have is we have a mental health counselor that we have built into our OB office. And so we get to actually start assessing families for any sort of hiccups or extra support that they may or may not need early in pregnancy, so that we're prepared and can help have a great path for success at the time of discharge and then well beyond that. So, yep, thanks for asking.
Thank you. I think we've got a couple more questions that we have time to answer. Melinda, what all can the birthplace triage nurses be utilized for? And then where should they park when they come in to see us?
Great question. So we're super lucky here at Birthplace to have a dedicated triage nurse. So each shift, that is one of our most experienced nurses, labor nurses. And we have a 5-bed triage, and that is just for anybody pregnant who's having any issues. So typically 20 or more weeks along, we will see you up on Birthplace. If you have abdominal pain, just not feeling good, you think your water broke, there's a multitude of reasons why you could be seen in our triage area. Obviously that triage nurse also carries a phone. So there's kind of a 24/7 hotline for pregnant patients as well. That's 354-6261. We'll get you right to them. But if you do need to come in, you park in the main parking garage, come in the main entrance 24 hours a day. You don't need to go through the emergency room. And then you come up to the 4th floor. We have admissions office up here. They'll check you in. We'll see you in triage. If you are going to stay, you're in labor, things are progressing, then we'll move you down to our labor and delivery side. We have a labor and delivery locked unit. We have 12 labor suites, and then we have 6 additional overflow. I saw there was a question that asked if we have issues of it being full. I've never had to turn away a patient, so we make it work. I guess that addresses all the questions. Yeah, and then park in the main parking area.
Great, thank you so much. I don't see any other questions coming in, but if you have questions that you think of after watching some of the virtual classes or something that spurs your curiosity, again, email Libby Rosen, lrosen@stormontvale.org, and she can get you the Zoom link for the Ask the Expert session. We can answer breastfeeding questions, baby questions, and then working on Birthplace, I can maybe answer some of these other questions or get you the people that could help you answer those questions as well.